Hello, hi. How are you? My name is Marla North Henry. I'm a nurse practitioner student here. What is your name?
Savani Ferguson.
Okay. Do you mind if I call you Miss Ferguson?
That's fine.
And is it okay that we take this interview session before
It's
we
fine.
start? Okay, very good. Hi, Miss Ferguson. And what brings you in today?
Well, lately I've been having a lot of irritation in my eyes, so I just wanted to come in just to find out what was going on.
Okay. And when have you noticed these changes?
About a week ago.
And is it happening in both eyes?
Yes, that is.
And what is exactly happening?
I just feel a lot of irritation, sometimes a little bit of burning sensation, and sometimes also when I wake up in the mornings, I'll have a little bit of discharge in the corners of my eyes, and throughout the day, sometimes my eyes can get a little red.
Okay. All right. And this has been happening for a week?
Yes.
Okay. Any pain in the eye?
No, no pain.
And the drainage, what color is the drainage?
It's usually just like a clear liquid, just like a clear color.
And you said redness
Yes.
in both eyes?
Yes.
Any swelling to the eye you notice?
No.
Has this happened to you before?
I do recall this happening last year when the weather started getting warmer too, around this time too.
And what did you do exactly to help relieve?
Just regular over-the-counter eye drops like Visine, just to help with irritation.
Have you used Visine this time?
Yes, that's what I'm currently using now.
And has it been relieving the system?
It does for a little bit, but then it just goes back to the irritation and burning sensation.
Any allergies?
Not that I'm aware of.
Okay. Any changes in your environment that you notice from home?
Usually when I get outside, I notice that my eyes start to get more irritated when I'm outside.
So it happens inside the house and outside of the
Yes,
house?
but usually outside is when it just becomes very unbearable.
Okay. All right. A week. All right. Have you noticed any changes in vision?
No, no changes in vision.
When was your last eye exam?
A year ago.
And how was that?
Everything was fine. Everything was normal.
Do you wear any glasses?
No, I don't.
Have you ever had any surgeries to the eye?
No, I haven't.
Right. Okay. And I'm just gonna go down, just in the history, to make sure we have everything connected. Any past childhood illness? Any chicken pox,
I
measles?
did have chicken pox when I was younger.
Okay. And as far as adult?
That I recall, no. But I was admitted once for gestational diabetes with my son when I was pregnant.
So you were hospitalized
For that.
gestational diabetes.
Yes.
And what year was that?
My son was born in 2006, so that was in 2006.
And that was the only time you've been hospitalized?
Yes. Mm-hmm.
Okay. And as far as your immunizations, are you up to date with?
Yeah, everything is up to date.
Okay. Family history, is your parents living? Your
My mom is, but my dad is deceased.
Okay. And your mom, what is, does she have any medical issues?
She does suffer from diabetes.
Diabetes? How about your dad? Do you know what he passed away from?
He used to drink a lot, so if I'm not mistaken, I believe it has something to do with like liver issues.
And what age did he pass away?
At 80.
At 80? How about your grandparents?
Well, my mom, both of her parents died when she was 6, so I really don't recall any, I don't know the family history behind them. And as far as my dad, I really wasn't close with his family, so I don't really know anything about them.
Do you have any siblings?
Yes, I do, 2 sisters.
And are they living?
Yes, they are.
And what do you currently do?
I'm a hospital care investigator.
And what's the highest educational level?
I just got my master's not too long ago.
Right. Do you drink?
Occasionally.
Meaning how
When
many?
if I go to a little social event, I will have a glass or 2 of wine.
Okay. A glass or 2 every.
Maybe like every month.
Do you smoke?
No, no smoking.
And how's your diet?
It's good.
Do you exercise?
No, not at all. I know I should.
Okay, you don't exercise. Okay. Okay. Now I'm just gonna go through, have you noticed any, we're going through the systems, through your systems, okay? You just let me know if you have any, issues, in those particular areas, okay? Have you noticed any, fever, chills, any weight changes, any
No, not at all.
fatigue? There's any change, sweat, night sweats?
No.
Sleeping pattern, change?
No.
Have you noticed your skin, any color changes, any, dryness or
No,
any
not at all.
issues like that? Any skin breakage, you
No.
know, it's okay. Your hair, have you noticed any changes in the color, the texture,
No,
any hair loss?
no,
Changes in the nails, have you noticed any brittleness or
No.
any infection or any,
no,
okay, swelling to the fingertips or, okay, headaches, have you had any
no
headaches?
headache.
Any trauma to the head area?
No.
Any jaw pain?
No,
All right, we covered the eye, all right, and then your ears, have you noticed any, do you have any trouble hearing?
no,
Any ringing in the ears?
No.
Okay, any draining in the ears, any pain in the ear area?
no, not at
Notice any nosebleed?
all.
You had, any obstructions in the nose?
No,
Okay, any pain?
no,
Okay, any sinus issues, any surgeries in the nose? Horrible, when was your last dental,
actually, it was a year, I'm sorry, a month ago, I apologize. Everything
A
was
month
good.
ago?
Mhm.
Okay, very good. And what was, any findings?
No, everything was okay. My
Any-
teeth are fine.
No changes in gingivitis or any swelling, any difficulty swallowing?
No,
Okay. Have you felt any stiffness in the neck area, any lumps you felt in
No.
the area? Okay. Do you do breast self-examination?
yes, I do.
Okay, have you noticed any lumps?
No, I
or
haven't.
Okay, any nipple discharge, any
No.
changes? Okay. Any, trouble breathing, any coughing, do you notice
No.
any, pneumonia? Have you had any asthma, history of asthma,
No.
chest pain? Okay. Have you had any cardiac issues?
No.
Any, hypertension,
No,
any palpitation, any chest pains, any angina?
no,
Okay. Any changes in appetite?
no,
Any nausea, vomiting, excessive thirst?
no,
Okay. Any changes in bowel patterns?
no,
Urination, have you ever noticed any frequency in urinating, any changes in the urination?
no, everything was normal.
Any recent UTIs?
No,
And what was your last menstrual period?
it actually was a month ago, which was, if I'm not mistaken, like May 1st or 2nd. So I'm due for one now.
Any pain in the muscle area, any
No.
bone or joint pain? Any range of movement restrictions?
Not at all.
Okay, any stiffness, any swellings?
No.
Okay, any fractures, any
No.
weakness?
Mm-mm. No,
Do you have any history of any seizures?
no, I don't.
Okay, any dizziness?
No.
Memory loss?
Nope.
Do you have problem with focusing?
No.
Okay. And have you had any childhood behavioral problems?
No, I don't.
Okay, any anxiety, any mood
No.
disorders?
No.
Do you notice that you easily bruise?
No, I don't.
Okay, any transfusion issues?
No,
Have you noticed any heat and cold intolerance?
no, I
Any
don't.
changes in weight?
No,
Okay, any excessive thirst?
no,
Okay, excessive urination?
no.
No. All right. Okay, we just went over the system. I just want to make sure I connect everything before I start my focus examination on you. So you did come in with the issues just because of the eye pain, is that correct?
Yes.
I mean, the eye irritation.
Yes, but eye irritation.
All right, just give me a minute. I'm gonna go gown up and then we'll come back and then I'll do the physical physical examination, we'll check the eye for you, okay?
All right, thank you so much.
Thank
Appreciate
you.
it.